Let's see an NCLEX RN video based on assessment of visual function. The nurse is interviewing a patient prior to undergoing an eye examination. Which is the most important question the nurse should ask this patient? Does anyone in your family have night blindness or glaucoma? What is your usual height and weight? Have you had your cholesterol checked in the past 2 years? Do you notice any difficulty sleeping at night? Family history is an important factor in determining the risk for development of blindness and glaucoma, as increased incidence have been noted with these specific diseases. So, prior to undergoing an eye examination, the nurse should question about family history of having night blindness or glaucoma. Which action should the nurse perform prior to an eye examination? Ask the patient if he needs to void first, turn off overhead lighting in the room for a more accurate examination, explain to the patient what to expect, obtain a set of vital signs including temperature, pulse, respiration and BP. Explaining what to expect prior to the exam helps to decrease anxiety and increase cooperation during the eye examination. A 45-year-old patient informs the nurse of several symptoms that have been encountered over the past 5 years. Which finding corresponds to expected age-related changes in the patient's eye? Intermittent lines appear in the visual field, increase in dryness of the eye and need for reading glasses, inability to see far away objects, inability to distinguish colors. After age 40, an increase in eye dryness, which is due to hormonal changes, and a need for reading glasses secondary to loss of lens elasticity occurs commonly. So, as a nurse, need to see for increase in dryness of the eye and need for reading glasses. Which post-fluorescein angiogram discharge instruction omitted by the nurse could be considered negligence? Keep your head in an upright position for at least a week. Yellow discoloration to the skin and green urine can be expected. Remain NPO for at least 12 hours post-procedure. Notify your practitioner if bleeding starts. Fluorescein angiography procedure provides detailed images about the internal eye circulation. Here, an IV dye, usually 5 ml of a 10% fluorescein solution, is injected and photographs are taken in rapid sequence. So here, after this procedure, nurse need to tell to the client that there are chances for yellow discoloration of the skin and green urine can be expected because of the dye. So if the nurse is omitting this instruction, that is considered negligence. The nurse provides which discharge instruction to a 70-year-old patient who has just completed a comprehensive eye examination that included eye drops to dilate the eyes or the pupils. Drink plenty of fluids to help flush out the administered eye drops. Arrange for a family member to drive you home from your appointment. Wear sunglasses in bright light conditions for the next 24 to 48 hours. Keep your head elevated for the next 12 hours to allow the eye medication to circulate. After the use of a dilating eye drops, the lens is unable to accommodate properly, potentially making the patient blind in certain light conditions. So we need to arrange for a family member to drive the patient home after the appointment. In assessing a patient's vision, the nurse recognizes which structures are key to the visual system. Uvea, lacrimal gland, macula, eyeball, cochlea, retina, fovea, retina, macula, round ciliary body, aqueous humor. The fovea, retina and macula are the key structures needed for vision. The lacrimal duct provides moisture but not directly related to vision. The cochlea is a part of ear. The aqueous humor helps to provide the structure of the eyeball but has little role in visual acuity. The nose recognizes which action as the major function of the visual system. Differentiate colors, convert light into nerve signals for the brain to interpret, focus light onto the choroid, accommodate vision from light to dark. The major function of visual system is the conversion of light into nerve signals for interpretation leading to sight. The cones are responsible for color differentiation. The choroid is behind the retina. Accommodation of vision from light to dark is just one aspect of vision. So convert light into nerve signals for brain to interpret is the major function of the visual system. What assessment data are most important in completing a history and physical examination of the eye? Family history, current state of health, record of daily food intake obtaining an accurate weight of the patient, medications taken daily and occupation, use of sun protective glasses on a daily basis and immunization history. Family history and general state of health are closely associated with eye or visual health. Weight is not generally associated with eye health. Medications and occupation may be relevant but not as necessary to history. Use of sunglasses is more closely related to potential damage to the eye. The nurse prepares the patient for which common diagnostic evaluations during a visit to an eye care provider? Pupillary light test, ultrasound of the eye, test of peripheral vision, otoscope examination, test for presence of bacteria in the conjunctiva, pupillary light test, Snellen eye chart examination, peripheral vision check. The Snellen eye chart and the peripheral vision checks are part of the eye examination. The otoscope examination is for assessment of the ear. Bacteria testing in the conjunctiva is not part of a routine exam but is indicated if there is redness or inflammation of the eye. Ultrasound is not typically conducted unless there are suspected cataracts. The nurse must consider all of these assessments prior to preparing the patient for diagnostic studies of the eye. Which intervention can be delegated to the technician on the team? Assessing the patient's past medical history, administering pre-procedure medications, obtaining an accurate height and weight of the patient, reviewing current medications patient is taking daily. Technicians and nurse extenders or assistants may obtain height and weight. The other interventions require a licensed or registered nurse. The nurse recognizes which action is most important to preventing eye trauma. Wearing protective goggles at home or work as indicated, keeping hands clean, refraining from looking directly into the light sources, eating a well-balanced diet. Eye protection such as use of goggles is the most effective way to prevent eye trauma. Maintaining clean hands and refraining from direct light are important for eye health, but they are not related to prevention of eye trauma. The nurse recognizes which findings as expected changes in visual function associated with aging. Presbyopia, decrease in general color perception, more narrowed fields of vision, otosclerosis, decrease in general color perception, increased tear production, pupillary miosis, presbyopia. Only presbyopia and decrease in general color perception are associated with aging. Otosclerosis is the disorder of the ear. There is increased dryness of eyes with aging, not increased tear production. Pupillary miosis is a term associated with pupillary constriction. Mike, who is 48 years old, is seeing her nurse practitioner for a routine checkup. Mike believes she is in excellent health with no non-chronic diseases. She works full-time as a middle school English teacher, takes no medications, is careful to eat at least 4 servings of fruits, vegetables per day, and has no significant family history of medical problems. She has been noticing some changes with her vision over the past 5 years that she plans to discuss with her practitioner. Her most common complaints are dry eyes, difficulty reading unless objects are held at arm's length, and spots that move in and out of her visual fields on occasion. During the appointment, the registered nurse completes a visual acuity test to assess current visual status. The advanced practice nurse practitioner then completes a full eye examination using an ophthalmoscope and Rosenbaum pocket vision screener to assess the internal health of the eye as well as her near vision. Findings of the examination includes expected changes such as the presence of dry eyes, floaters in her vision field caused by opacities present in the vitreous, the need for reading glasses or eye magnification as determined by the result of Rosenbaum test, reflect the expected loss of lens elasticity that is an anticipated change seen with healthy aging eyes. The advanced practice nurse refers Mike to an optometrist for further evaluation for glasses or contacts. She will also need to use moisturizing eye drops to ensure that her eyes stay lubricated, obtain and use reading glasses for near vision, and schedule yearly eye examination to ensure optimal eye health. She is also provided with instructions on vitamins to support eye health. So this is the case. Which changes in Mike's vision are expected age-related clinical manifestations? Frequent tearing and spots in her vision fields, difficulty reading objects when held at arm's length, dry eyes and difficulty reading unless objects are held at arm's length, itching of both eyes and blur vision. Dry eyes occur commonly due to hormonal changes that occur with the normal aging process, and loss of lens accommodation causes difficulty reading and objects need to close up. Which test does Mike's provider order based upon her presenting clinical manifestations and history? Visual acuity test with ophthalmic examination, a CT scan to rule out the presence of tumors or other pathology, ophthalmic examination using fluorescein to check for foreign bodies, ophthalmic ultrasound to rule out the presence of cataracts. In a provider's office during a routine checkup, a visual acuity test and examination with an ophthalmoscope are expected test. In addition to focused examination of the eyes, what other data should Mike's provider assess? Immunization history, dietary history, travel history, obstetrical history. Dietary history has an impact on vision. Vitamins and nutrients have the ability to impact certain eye conditions. Based upon her clinical presentation, Mike's provider is most likely to offer which action? Increase carrots in her diet to help stimulate her visual acuity, use of lubricating eye drops for 2 weeks and then return for a follow-up examination, get at least 8 hours of sleep at night, schedule a follow-up examination with an eye care specialist. Follow-up with an eye care specialist is appropriate to rule out any other pathology causing a change in patient's vision. So, need to schedule a follow-up examination with an eye care specialist. What is the rationale for Mike's provider to perform the Rosenbaum test? Assess Mike's near vision, assess Mike's far vision, assess Mike's peripheral vision, assess Mike's central nervous system for function. So here, the Rosenbaum test assesses for near vision. Hope you understood this video. Keep watching. Thank you.